so long? Why can't I stand up and tell myself I'm strong? Because I saw her today, I saw her face, it was a face I loved, and I knew.
The Mighty 790 and 104.7 KFGO. Good afternoon. Thanks so much for joining us. This is The Drive. I'm Dan Michaels, your host. Polly Lyons is our producer, and Paul Driggins is in the KFGO News Center. Thank you very much for being with us this afternoon. The Delta variant has been getting some publicity lately. That is the new, more deadly, strain, more virulent strain of the COVID-19 virus. And so we thought we would ask some questions about that, and we're turning to an expert. Dr. Richard Vetter is a family practice specialist and chief medical officer at Essentia Health in Fargo. He has served as director since 2020. A lot of experience in integrated health system operations, rural health care. His resume goes on and on. He served as president for the North Dakota Academy of Family Physicians and for the North Dakota Academy of Family Physicians Foundation, and on and on. Would you please welcome to the show Dr. Richard Vetter. Hello, Dr. Vetter. How are you, sir?
I'm doing great. Good afternoon.
Thank you so much for being with us today. So, Dr. Vetter, can you describe the Delta variant to the COVID-19 virus, and why is it more serious?
Yeah, so the COVID, or the coronavirus that causes COVID-19, there's been 5 main strains that have been identified with that are different variants of the original COVID that was first recognized in China. So there's 5 main strains. There's 12 different subtypes and over 12,700 mutations. So the virus, like other viruses, continues to change and morph, and every time it replicates, there's a chance that a mutation can occur, and when those mutations become frequent enough or often enough, then a new strain is identified. The Delta strain was first identified in India, and historically in the U.S. it's been a lower number. It's a couple weeks ago was around 6%. Last week I think 10%, and now it's being reported close to 20% of strains in the U.S. are this Delta strain. And just like you recall a few weeks back in India, the significant challenge they were having with this strain, because it's felt to be much more transmittable or much more contagious, so it transfers a lot easier than some of the other strains did. The Alpha strain, which is another strain, was first identified in the UK, and that's been the one that's been the most common in the US. But as I mentioned, with this rapid transmissibility, that the COVID Delta strain is becoming more and more prevalent, and felt to be, or will be, the most prevalent strain in the U.S. as well as worldwide in the coming weeks.
Dr. Richard. Go ahead.
Go ahead.
Sorry.
Well, I was going to say the concern about the Delta virus, because it is more transmittable, particularly in areas where the vaccination rates are low, we think that virus can take a foothold and continue to transmit and make more people sick. So far, the vaccines that we have, particularly the Moderna and the Pfizer vaccine, have been shown to be about 80 to 90% effective in preventing illness from this strain as well. So currently, we feel pretty good with people that are vaccinated, but we have a bigger concern, particularly in areas where the vaccination rates are lower.
Dr. Richard Vetter is joining us today. He was named North Dakota Family Physician of the Year in 2009 and Best of the Valley Family Health Physician in 2013 and 2014. Dr. Vetter joining us as we're talking about, in particular, the Delta strain of the virus, which apparently is easily more transmittable. You were talking about India just a moment ago, Dr. Vetter. And, you know, what was one of the more fascinating things when we first got into COVID was how India seemed to be immune to the disease. It wasn't popping up. It wasn't having much of an impact on there and on the country and on people in India. And then all of a sudden, this other variant comes out and kaboom, it just exploded. What are your thoughts about that?
Yeah, so I think any time that you get a new strain of a virus that the population has not been exposed to before, they're going to be much more susceptible. You know, probably a good example would be the flu vaccine or the flu influenza that we see every year. Every several years, influenza changes a little bit every year, and that's why we continue to modify the vaccines. But every couple of years, there's what's called an antigenic shift, where it just shifts and a whole bunch of changes occur with that virus, and so the population is much more susceptible. And so about every 3 to 5 years, you see this increased wave of influenza across the country and across the world. So viruses behave in that manner. They continue to change and try to get around the mitigating factors that we put in place, whether it's, the hand hygiene or the social distancing, the masking we were doing, and now the vaccines. The virus, wants to figure out a way to survive, and so it continues to morph and change to try to stay ahead of us. So we need to do a good job of staying ahead of it with vaccines and preventing a large portion of our population from being susceptible.
So, Dr. Vetter, then, are you saying that the way to stamp out this variant of the virus and any other is to make sure that we have a high percentage of people that are vaccinated?
Yes, that's the theory behind that, and there's good evidence to suggest that that's true. The challenge, of course, is that we may get a variant where the vaccines are not effective, and then we'll have to go back and develop a new vaccine and basically kind of start all over again. And so I don't think any of us want to face that. And so the concern, of course, is for those that are unvaccinated, particularly those at high risk. We know that most of our elderly have been vaccinated, over 80% in North Dakota. But if you get to some of the younger age groups, it's only about 20% have been vaccinated. And so the concern is that, number one, they can catch it and potentially get ill from it, but they can also continue to transmit it and then expose others who have risk factors that might get sicker from it.
So, Dr. Vetter, if I'm, reading what you're saying to me, you're basically saying that people who will not get vaccinated could be responsible for a strain that we can't control.
Well, they can certainly act as the vector for that transmissibility. And like I said, luckily at this point, the vaccines that we've used have shown to be pretty effective against this strain. At some point, the concern is, of course, that if you have a strain that the vaccines don't work, that, again, we'd have to start over with a new vaccine. So we would highly encourage people, to consider getting vaccinated if they haven't already done so. And maybe not even just for themselves, but for the greater good of the population.
I think that's what this whole COVID thing has been about, Doctor, is if we all look out for the other guy, we would have got rid of this already. So how do you convince those who don't believe in the virus or think it's some kind of strange conspiracy theory, or, the worst thing is people who believe politically, therefore this disease isn't real? How do you get them to take this seriously and to get this shot?
Yeah, well, I think you just have to look at what we've been through over the past year. And if you look at the number of deaths, certainly, you could argue that some of those deaths, were COVID related, but, they maybe had some other health issues that they might have, died from even without COVID. But certainly COVID acted as an accelerant and caused those people, die prematurely. I think the data, in my mind, is very clear. And if you look at, since we started vaccinating, you look at our hospitalization rate, back in November, we were almost overcome our hospital systems, and people that would have been coming in with other, heart attacks, stroke, broken bones, they wouldn't have been able to get care if we wouldn't have had enough space in our hospitals. And so we came very close to that. Now, luckily, I think we're past the worst of it with the vaccines. And, in Cass County, I think our vaccination rates are around 60% of all eligible people for the vaccines. But in the western part of the state, as you know, it's a little bit less than that. And so I think it's, try to focus on the science. I know people have talked about that, and try to focus less on the politics.
Yeah, it's amazing. What a lot of people don't realize, when we had this on, I would guess about 2 weeks ago, is more people have died of COVID-19 in 2021 than all of 2020 already. America has gotten a pretty good grip on what's going on. There are some hot spots around the country. But outside of the United States, people are really having a big problem with this disease.
Yeah, I think if you look again at the, experience in India just a few weeks ago, not enough ventilators, not enough hospital capacity. We've had lots of people in the U.S. that have survived COVID that have been on ventilators for a week. And I think most of us probably know somebody who's had COVID or been hospitalized with COVID. And I think, if you want a reality check, I would talk to those people who've been sick with it. And even people who haven't been hospitalized have been sick, you just don't feel very good. And so I would hope that people would think about it not just for themselves, but think about it from a public health perspective and how do we reduce the risk for others. It's kind of like you could relate it to, other things that we do as a society that we regulate, like drinking and driving, right? You could say, well, that's my own life, but if you end up killing somebody else, then that's a public health issue. So I think, again, it's do it for yourself, but do it for your neighbor, your friend, your family, your coworkers.
Brad Paisley, the country singer, I thought had a great analogy the other day. He was talking about how he was comparing the virus to your neighbor getting a fire in their house, and everybody in the neighborhood comes running, and we all try to get some water on that. And same thing with this. If everybody just kind of came running and we use the vaccine as putting some water on it, we get the fire out. So the future of vaccines, boosters, are we going to need a vaccine shot every year? Going to need a booster shot every year?
I think at this point I would say the jury's still out on that. There's ongoing surveillance to monitor people who've been vaccinated, contracting COVID or becoming ill with COVID. And we certainly know that the vaccines aren't 100%, so some people are going to get COVID even after vaccination. But we do know that the rate of dying and being hospitalized is almost zero if you've been vaccinated. Mm-hmm. So they're extremely effective vaccines. I think if you would have said a year ago we would have a vaccine that'd be 95% effective, people would have never believed it. If you look at our history with vaccines, we've been able to wipe out polio, we've been able to wipe out measles to a large extent, other illnesses that, caused a significant number of, morbidity and mortality in the past. And I think people, just need to remind themselves that, our vaccination efforts historically have been very successful. And I think, COVID will turn out to be that way as well. We just got to get people to focus on, doing the right thing.
Dr. Richard Vetter is Chief Medical Officer at Essentia Health in Fargo. He's been joining us today talking about the Delta variant. And so can we still just call Essentia and get a shot? How do we do that?
Yeah, we are offering it now at several different locations. We closed up the vaccination center as the numbers or the demand went down. So now we do offer it at a couple locations within Fargo-Moorhead as well as many of our satellite locations. And so if you call our line or you go on our website, you can schedule a vaccination on our website or call our appointment line and make an appointment to get vaccinated. And we have ample supply.
And excuse me, doctor. And if you do have a little bit of a reaction, all that really is saying, doctor, isn't it, that the vaccine is working? That's what your body is telling you. Isn't that correct?
That's correct. You're getting an immune response, and it's turning on your immunity, which is what we're striving for. I think if you look at the number of significant side effects from the vaccine, it's like reported at 5 per million. So do some people get a more serious reaction? Yes, but is it common? By no means. But frequent low-grade side effects are very common, but they're self-limited. They last for a day or so. You can treat it with some Tylenol or Motrin, and most people do quite well.
Dr. Richard Vetter, Chief Medical Officer at Essentia Health in Fargo. Dr. Vetter, we sure appreciate your expertise. Thanks so much for joining us today, and hope you have a great weekend.
It's been my pleasure. You have a great weekend as well.
Take care. KFGO time coming up on 423. You're listening to The Drive with Dan Michaels on the Mighty 790 and 104.7 KFGO.
You're listening to The Drive with Dan Michaels.
I guess I was going about 65 tops.
7 miles an hour.
On the Mighty 790 and 104.7 KFGO.
Why you in this roadside fireworks tent?
I wasn't getting by on my banking wages, John, which is why I had to open this fireworks stand.
Where's the good stuff?
This is the good stuff.
So you're going to tell me that you don't have no Wise Guy, no Sky Slam, or Sin City?
No, I don't.
You're going to stand there owning a fireworks stand and tell me you don't have no Private Pirate, no ISIS alarm clock,
no, I don't.
Cartel Night, Shoot Rooster?
No, I don't.
You didn't shop at Starfire.
No matter your budget or taste, Star Fireworks has hand-picked assortments to celebrate America. The American tradition with aerial cakes, reloadables, fountains, and Roman candles. Or the all-new neon shells reloadables where you control the action. Star Fireworks. Skip the sketchy tent and shop air-conditioned. Star Fireworks. First exit south of the 52nd Avenue exit. Wild Rice exit off I-29 and now at the fairgrounds. Visit star-fireworks.com.
Star Fireworks, light up your night. Star Fireworks, Star Fireworks.
The Fargo Air Show is back on July 24th and 25th with the U.S. Navy Blue Angels flight team. Thrill to precision aerobatics from the Blues, plus many other civilian and military acts. New this year is the family ticket package, for sale online, only $49. Advanced tickets for adults are $20 and $10 for youth. Visit FargoAirshow.com for all details. Sponsored by Rad Aerosports.
For over a decade, the North Dakota oil and natural gas industry has been advancing the possibilities for flood control, schools, roads, and property tax relief in the Fargo area by providing more than $1.3 billion in state tax revenues for local projects. It's helping make the Fargo area a better place. Learn more at ND Petroleum Foundation.